Cosmetic Dermatology is one of the top destinations for healthy, glowing skin. They're known for cutting-edge, results-driven treatments. Jess Wills got to visit with board-certified dermatologist and internal medicine doctor Kathleen Walsh to learn about Exomind, a technology that's changing the game to get patients results.
Hey everyone, today we're at Bay Area Cosmetic Dermatology. They specialize in using state-of-the-art devices and scientific skincare strategies to prevent and reverse aging and enhance your overall well-being. I'm going to check in with Dr. Welsh to see how she's using Exomind with her patients. I'm here now with Dr. Kathleen Welsh. Dr. Welsh, it's so good to see you.
Thank you so much.
Yes, we are talking about attaining health and beauty goals, and there is a treatment that is pairing really well with some of the popular treatments that patients are already getting. So tell me, what is Exomind?
Exomind is transcranial magnetic stimulation. It was invented in 1985 and FDA approved for the treatment of depression in 2008. It targets the dorsolateral frontal precortex of the brain. This is the part of the brain that's responsible for emotional regulation, planning, and also self-control.
So how does the treatment actually work? What is it and what does it do?
It produces gentle magnetic stimuli, which causes the brain cells to develop new and more effective pathways. This allows you to have more clarity of thought, self-control, and improves emotional well-being.
I feel like I already just have a calmer sense of understanding what it does. I think everyone is searching for that in their life. But you guys are a dermatologist practice. So how does this fit into your practice? Why do you offer this?
Well, we help patients look better, but it really doesn't mean anything if they don't feel better. I think we know that in this day and age, all of us are struggling with more stress, anxiety, and burnout than ever before. So we can offer something to improve how patients feel about themselves. I think that's one of the most important things we can do.
Absolutely. I think when you feel good on the inside, that really shows and shines through on the outside. So that sounds amazing. Now, who would you say is the best candidate for this? Who would benefit the most?
Well, in the community, I think that we have several groups. One is women who are going through times of hormone change. This would be perimenopausal women, menopausal women, and women in the postpartum period. Many of these women complain of brain fog, anxiety, and depression and sleeplessness, and these women would greatly benefit from this treatment. In addition, patients who are struggling with their weight. I think we know that GLPs have changed that landscape. However, most patients, when they go off their GLP drugs, regain that weight within a year. Exomind reduces the food noise, helps patients make better choices around food, and improves self-control. We have one patient who's been yo-yo dieting her entire life. After 6 sessions with Exomind, she reports that she's no longer binge eating and is on a healthy weight loss program.
Wow, we know how popular these GLP drugs have become. So now, you know, if there's something that could pair with it to even make it more effective after you've come off the drug, I think that that is just incredible. I have to ask about safety. I know when it comes to your mind or any treatments that you're doing for your mind, everyone's gonna have the question, well, just how safe is this? So how safe is Exomind?
This is extraordinarily safe with many fewer side effects than drug therapy. The most common side effect would be a mild headache after the treatment. Obviously, patients who are under the care of a psychiatrist for bipolar disease or schizophrenia or any other treatment should consult their psychiatrist before beginning any treatment.
Well, Dr. Welsh, you have a patient that actually just went through a treatment, so I'm going to check in with her and see how she's feeling.
Great.
I'm here now with Angel, who just went through treatment. How are you feeling?
Really good, really relaxed.
Good. Take me through the experience. The treatment's about 25 minutes long. What were you feeling during that?
I felt the device itself sort of resting on my head and then like a tickling sensation on the scalp. It was relaxing enough that I honestly started to fall asleep and then the treatment was over.
Yeah, incredible. I love that's easy, breezy. Take me through your journey. Why did you feel that Exomind was going to be good for you?
Yeah, I've been on weight loss medication off and on, and I've had great success with it really helping with that food obsession, like that thinking about your next meal all the time and the cravings. And when I come off some medication, those come back and so does the weight. So Dr. Walsh had mentioned that she felt like this might be a good tool in helping me transition off those medications and quieting some of those food cravings.
Yeah, I love that it's something that paired well with a treatment that you were already doing to help you get the results that you're seeking. What would you tell to anyone else who's thinking of doing Exomind and maybe that it would be good for them?
I mean, honestly, if you struggle with yo-yo dieting your whole life or part of your life like me, I think it might be worth a shot.
Angel, thank you so much for sharing about your experience. I'm glad it was just very relaxing and easy.
Thank you.
Dr. Wells, she seemed so comfortable in there and excited to continue on with her treatments. I wanted to talk to you a little bit more about results. What can patients expect as they're going through a series of treatments?
Well, even before patients have finished their treatment series, they report that they feel better overall. They have better clarity of thought, they're able to make better choices, and better able to manage the stress of everyday life.
And I think the most important thing is this is without drugs.
That's true.
Yeah, well, thank you, Dr. Welsh. It's been so fascinating to learn more about Exomind and just how it pairs well with treatments that you already offer and how it can benefit patients just on their own as well. So thank you so much.
You're welcome.